in pursuit of health and wisdom. Sapio with Buck Joffrey.
Welcome back to Sapio with Buck Joffrey. I'm Buck Joffrey. Today, I'm going to talk about a topic that I've been thinking about since a conversation with Dr. John Foley, who was a neurologist when we were talking about Alzheimer's disease. And, you know, in that conversation, he used the term inflammaging, which is like, you know, sort of this buzzword that's out there right now to describe this idea that the role of inflammation in human beings is significantly more important than we used to think, and that it might have a major role in all the things that we think of these days as aging, right? This is actually a kind of a new thing, I got to tell you, because when I finished medical school, and this is, you know, back in the early 2000s, and back then, we really didn't appreciate what a major role inflammation played in so many disease processes. And again, this whole concept of inflammation's role in all these diseases is still in its infancy for the most part, in my view. But every day I keep learning more and more about the role of inflammation in just about every disease known to man, especially those that we consider diseases of aging. And again, that's where this term inflammaging has been starting to be used. I don't know who made that up, but it is an interesting way to look at it. And it's been used to describe the human aging process itself. So I thought it'd be useful for me to go and review the literature, review the medical literature. And again, this is kind of what I'd like to do, you know, as a theme on this show, is to try to be very pointed about the stuff that I talk about, that it is in the medical literature. It's not stuff I'm just kind of making up. There's plenty of that stuff out there already, because inflammation is such a buzzword. I mean, you know, it's also like the word mitochondria, right? Like people use the word mitochondria to describe like 20 different things, and I swear a lot of those people don't even know what mitochondria are. And again, I am just trying to be trying to, you know, be accurate and give you good information as far as I can tell from the literature. I'm not coming at this with any particular bias, right? So let's start with the idea of what exactly inflammation is. First and foremost, inflammation is not necessarily a bad thing. It's the body's immune response, and it's initially serving as a protective mechanism. So it's not like just horrible thing. It's designed to remove harmful stimuli and ultimately to initiate healing processes if that's what is needed. So in the context of human disease, inflammation can be, you know, both acute, like so you get a bee sting, you get this acute reaction, or it can be a chronic. So acute or short-term inflammation, as we describe it, can be characterized by, you know, a bunch of various immune cells, such as plasma cells and leukocytes from the blood that suddenly go to, like, say, some injured tissue. I'm sure you've experienced it before. You get an insect bite, you get symptoms of redness, swelling, heat, pain, and eventually it resolves, right? Once it heals, it resolves. Twisting your ankle or other injuries might cause a similar response. Now, on the other hand, there's something that we call chronic inflammation, and that's prolonged inflammation that lasts for months or years. And this can result from a lot of things, like that ultimately may be like a failure to eliminate the cause of acute inflammation in the first place. Maybe there's a chronic irritant, you know, and that it's there, it doesn't go away. So there's this chronic intensity of the immune system, you know, constantly attacking it, and that causes this low-grade constant inflammation. And in some cases, you can see, you know, you've probably heard of autoimmune diseases or autoimmune responses where the body actually starts to mistakenly attack its own tissues. So that could be another source of, you know, chronic inflammation, because obviously your own tissue is not going anywhere. And if your immune system starts recognizing it as foreign, well, then you're going to have chronic inflammation on your hands. Now, it is chronic inflammation that seems to be creeping up again as an increasingly important player in almost all these diseases of aging that we have. We've known for years that chronic inflammation is involved with diseases for sure. Like we've known that it's involved with asthma. I'm a childhood asthmatic, so I can attest to that. And we know that it's involved with autoimmune disease. But these days, we're learning exactly how important the role of inflammation is in some of our, everyday killers. Our number one killer, cardiovascular disease, stuff like cancer, number two killer, things that are affecting huge numbers of people in our population, like Alzheimer's disease and neurodegenerative disease. They all appear to have an underlying factor where they are made worse, if not caused necessarily in part by chronic inflammation. Again, I don't know who to give the credit for, but inflammaging has been coined to describe this chronic low-grade inflammation that develops with advanced age, and again is increasingly recognized as a significant factor in all these diseases. So let's talk about some of these ideas. Like what exactly is this concept of inflammaging, the chronic inflammation that again permeates us as we get older. And the first concept I'll mention is immune system dysregulation. In other words, why does some of this stuff happen? And so with age, the immune system undergoes a remodeling process. It's also known as immunosenescence. As we get older, our immune systems are simply not, quite as good as they used to be at fighting off infections or identifying and killing cancer cells early on that might be forming. You may not know this, but people do develop cancer cells throughout their lifetime that don't go on to become cancer because our immune system is out there knocking them out before it becomes a problem. On the other hand, the immune system starts to also misfire a little bit and starts not recognizing our own cells, and that results again in this concept of autoinflammation or autoinflammatory responses. And as part of this, the aged immune system is ultimately characterized by this low chronic level of activation, which, because it's activated, starts releasing what are known as pro-inflammatory cytokines, or basically chemicals that are meant to fight off infections, even though there's no infection to fight off. So there's another important concept of inflammaging that you should know, and we've talked about this before on this show, which is cellular senescence. I've talked about this before in the context of some of the supplements that I take and are supposed to help with this problem. Senescent cells are, as I've described them before, zombie cells. So normally you got these healthy cells that divide for a while. They divide for a while and they go, and then they do their thing. They just humming along. And then they die because they're supposed to die. That's a programmed cell death. And the fancy word for that is apoptosis, otherwise known as apoptosis. Depends who, it's like you say tomato, I said tomato. So apoptosis. Bottom line is it's programmed cell death. And that's what's supposed to happen after, a number of reproductive cycles of any given cell. This is normal. And what it does is it clears the way for new healthy cells. Now, senescent cells, again, these zombie cells, what they do is at some point they stop dividing, but they don't die. And so that's why they're kind of like zombies, right? Instead, they just accumulate and start releasing these chemicals that ultimately turn other cells into zombie cells, into other senescent cells. And this creates inflammation, and it can also result in an environment that promotes cancer, as you might think, as you might think that would happen if you've got a bunch of non-functional cells that are not dying. And interestingly, there have been studies showing that removal of senescent cells, at least in animal models, can reduce age-related inflammation and actually improve health span. So it certainly seems to have a role in, again, this idea of inflammaging. Now, cellular senescence, which is, again, I'm going to keep going back and saying is the creation of these zombie cells, is thought to, in part, be the result of epigenetic damage that can create cellular dysfunction. What do I mean by epigenetic damage? Again, if you go back to some of our old shows, the idea is that it's damage to the parts of the genetic code that determine which genes are actually turned into real information. So that's the epigenome. Now, so cellular senescence can be the result of that kind of damage to the epigenome. Now, if you want to learn more about the role of the epigenome and epigenetic aging and all that stuff, go back to my interviews with Dr. Joel Rothman from the Center of Aging and Longevity Studies at the University of California in Santa Barbara. And we have a couple of shows on that dives really into it. But bottom line is, the point here is that there are things happening at the genomic level that might be contributing to these things that we're seeing, like cellular senescence or the accumulation of zombie cells. The reality is that aging is accompanied by, a number of genetic and epigenetic modifications, that can affect these inflammatory pathways and, can increase the expression of these kinds of pro-inflammatory genes. In other words, genes might get turned on that aren't supposed to turn on and cause inflammation. Again, that is sort of the big concepts when we're talking about, inflammaging, right? Another contributing factor to inflammaging appears to be changes in the gut microbiome. This is another hot area, right? A lot of people want to blame the gut on everything, which, I don't know, maybe they're right. I don't know. We don't know that much about what the reality is there, though. But again, what is the microbiome? What is the gut microbiome? It's the world of good bacteria, and it lives in your gut. And there's no doubt it has all sorts of positive benefits. But as we age, those healthy bacteria communities, we call flora, they often change. And this can contribute to, some problems with the gut, such as something called leaky gut syndrome. And think about what that is. Okay. So when you eat all this stuff, it needs to be digested. And the idea with digestion is complicated, right? Because what you're trying to do is pull out all the good stuff from the food and not absorb the bad stuff. And effectively what's happening is, when you have a young, healthy gut, you're pulling out the nutrients. You're not pulling out any toxins. But if your gut starts getting leaky over time, it starts allowing some of those toxins to get into your bloodstream. And that is another source of inflammation for your body to deal with. Now, finally, there's another factor that might be leading to this increased levels of inflammation as we get older in our bodies, and that is simply known as increased oxidative stress. You may have heard of free radicals and all that. Ultimately, that idea is that damage accumulates over time as we age, affects the genome, and we have all these pathways of aging, again, inflammation causing damage to genetic material and therefore contributing to diseases of aging. So how do we know there is more inflammation in our bodies as we age? I mean, is there, any evidence of that? Well, we can measure it in our blood. There are lots of biomarkers of inflammation. I won't go into much detail on that, but biomarkers meaning like various chemicals called CRP or interleukin-6 or TNF-alpha. Again, I don't want to get lost in the jargon. Suffice to say, there are these generic markers that show up and that show that how much inflammation is the body, and these go up as we age, and they also go up in patients who have diseases such as cardiovascular disease, cancer, Alzheimer's, diabetes. And we know from large-scale population studies that higher levels of these inflammatory biomarkers are actually correlated with higher levels of death in the elderly. Again, that makes sense, right? If you buy this concept of inflammaging, that inflammation and aging are very, very tightly linked. That makes a lot of sense. And interventions that reduce inflammation have actually been shown to improve some health outcomes in older populations, and we'll get to that as well. So let's talk specifically about some of the major diseases of aging and how inflammation seems to play a key role, because at the end of the day, the hypothesis of this whole thing is, chronic inflammation leads to aging. And if it leads to aging, it probably is leading to some of the major causes of death, right? So what is the most common cause of death right now is still cardiovascular disease. I think that'll change in the coming years, especially if people start sort of getting on board with what's available to us. But when we think about cardiovascular disease, at least when I used to think about it, you go immediately to the idea that, you've got damage occurring to blood vessels that ultimately leads to stiffening and narrowing of those arteries and blood clots and other kinds of blockages. And that results in things like heart attacks and strokes. And well, I think that is true. That is all very true. Where it starts to get interesting and where maybe the whole story was not clear before, at least when I was in med school, was why all that happened. Now, the correlation of LDL cholesterol, the bad cholesterol, levels with, cardiovascular disease, all these things that I've been talking about here, they've been recognized for a long time, right? I mean, they're not new. Well, this is stuff that's been wrong. We've known about for a long time. We've known that, high bad cholesterol is going to make you more likely to die of cardiovascular disease. But the role of inflammation in cardiovascular disease, that's an area that might be just as important. And that's kind of, the newer stuff. But I will say that it's not that it's like one or another. These processes of high cholesterol and inflammation seem to be interrelated. For example, the cells lining the blood vessels, which are known as endothelium, they can become dysfunctional when they are inflamed. When there's inflammation happening at those level of the cells, they can become dysfunctional and not work as well. And that inflammation can be caused by all sorts of things, including high blood pressure, smoking, and LDL cholesterol. Elevated levels of LDL cholesterol, especially a form called oxidized LDL, gets into the artery walls. And when it gets into the artery walls, it causes more inflammation. And this inflammation then further promotes the accumulation of more oxidated LDL. So that cycle, it's basically a cycle. Increased LDL, inflammation at the wall of the artery, then more deposition of LDL in the artery walls. That cycle creates what becomes an atherosclerotic plaque. Okay, atherosclerotic plaque, what is that? They're plaques that are consist of like a core with cholesterol and fatty substances, and there's these inflammatory cells which are from the immune system coming in and reacting to all that mess. There's smooth muscle cells that are just part of the artery itself, and then there's like a fibrous cap. Now, this is an important thing because it's these plaques that ultimately narrow the arteries, and that process is called atherosclerosis and leads to reduced blood flow. And it's the rupture of these plaques that's often the critical event that, ultimately leads to the formation of a blood clot, and then you get the lethal cardiovascular event like the heart attack or the stroke. So again, you've got this vicious cycle of LDL deposition, causing inflammation, causing more LDL inflammation, leading to a plaque. The plaque leads to stiffening of the artery and narrowing. Then you get a blood clot, then you get a heart attack. Okay, so you can see it's like a two-part thing, right? It's just a feed-forward type thing. So it's really critically important to understand that inflammation plays a huge role in this. And this is something, again, I have to tell you, this is not something that I learned a lot about even 20 years ago in med school. Now, again, what we used to do, and what we still do for the most part, is focus on decreasing cholesterol, bad cholesterol. We focus successfully on that by medications. Obviously diet and exercise are key, are important. Some people just have higher cholesterol and they may need drugs. And that's where the statins come in. Or these days there's also, really strong ones called PCSK9 inhibitors. And those are also very, very strong medications to reduce cholesterol. And I just, I'll just be clear about this, regardless of the basis. There's banter on the internet like, oh, statins are bad for you, all that. There's really no evidence of that, guys. There is none. It's so funny because when I talk about this and then it gets posted on Instagram, I get these crazy, crazy people saying, oh, you're a doctor, you get paid a lot of money because of the statins. And I'm like, you have no idea. First of all, I don't even practice. I'm just, I'm a guy who makes his money in the financial world, not in the medical world. But I'm doing a lot of this stuff because I'm interested in it and I want to know for myself what the right thing to do is. And there is no literature out there suggesting that these things are bad for you or going to cause Alzheimer's disease. That's all nonsense, right? There are a very small number of people who do have some negative reactions to statins. And for those people, I would recommend another statin called Livalo that's come out that seems to, not have as many of those side effects for people, or a PCSK9 inhibitor. That's another option. But the bottom line is you got to get those, you got to get that cholesterol in control. That is a big part of the puzzle, but inflammation is also a big, big part of the puzzle. And so the question is, does decreasing inflammation then help with cardiovascular disease as well? Because obviously reducing LDL does. Well, first we got to measure inflammation resulting from cardiovascular inflammation in the first place. How do we do that? Well, there's something called high sensitivity CRP or HSCRP. And that is that's a biomarker that gets elevated when there's this low-grade chronic inflammation in the body. Specifically, it's helpful to know about atherosclerosis and other heart disease. So HSCRP tests are used to identify low-grade chronic inflammation of atherosclerosis and of other heart diseases. And it's important because it has been studied for its predictive value in cardiovascular death. So there's a fairly recent study, retrospective study, almost 300,000 patients there with suspected atherosclerotic heart disease. In other words, they've already got heart problems related to this whole narrowing and plaques and all that stuff that I mentioned. And what they found is a positive relationship between HSCRP levels and mortality. And it was graded. In other words, the higher those levels were, the more likely you are to die. And there was another study from the National Institutes of Health Research Health Informatics Collaborative that showed that the higher the HSCRP levels in a person with some heart disease, the more likely those people were to die over the next 3 years. So they also showed that even mildly elevated HSCRP levels can actually significantly increase the risk of cardiovascular death. And for those of you who really like to talk about studies, there was a recent study from the prominent Reduce It and Strength It trials that actually suggested that HSCRP might actually even be more critical as a factor, a predictive factor, than cholesterol levels, more predictive than cholesterol levels in predicting cardiovascular risk in patients on statin therapy. In other words, people who are already being treated with cholesterol-lowering drugs, in those people, their hsCRP levels was more predictive. Inflammation was more predictive of them having cardiovascular death than the actual levels of cholesterol. So if you think about that from the way I described, the way the atherosclerotic disease develops in the first place, right, with that crazy vicious cycle, that makes a lot of sense. It's like LDL cholesterol. It's like the fuel, and the inflammation is the fire, and you need both. And if you're controlling LDL levels, it would make sense that controlling these inflammation levels would potentially create an even bigger impact on reducing plaque accumulation and rupture. Now, in fact, there are at least 3 major trials, major clinical trials that have shown benefit of the gout drug colchicine in the reduction of cardiovascular death in patients with known heart disease. Now, colchicine, what it does is it is an anti-inflammatory drug, and it reduces hsCRP levels. Now, while I'm not advocating for anyone to do this, because I, even though I am a physician, I'm not here to give you any medical advice. Personally, I have actually started a low-dose colchicine myself. The reason for that is, if you go back to some of the battle of the cardio IQs that I did with my buddy, Dr. Alan Viglione, you could see that I smoked him in just about every category of cardiovascular, all these biomarkers, except hsCRP. For some reason, mine was mildly elevated. Anyway, why do I have to wait for a heart attack before taking measures to optimize my risk of not having a heart attack? So I started it. It started at 0.6 milligrams a day. And the studies, actually, I should point out, they're using 0.5 milligrams. And the only reason I can figure out why they're doing that is so they can rebrand it and sell it as a non-generic. But maybe somebody can tell me that there's some other reason to it. But if you're really worried about the dose, you probably just chisel away at that 0.6, and try to take 0.1 milligram off of it. But I doubt it matters that much. So anyway, so there's a compelling story behind Inflammaging, again, as it relates to cardiovascular disease. What about cancer? Well, again, start with the population studies. Now, those provide compelling evidence linking chronic inflammation to cancer. I mean, for example, individuals with chronic inflammatory conditions such as inflammatory bowel disease, hepatitis, chronic obstructive pulmonary disease, all those, strong chronic inflammation diseases have a higher incidence of developing certain types of cancers. We also know that lifestyle factors associated with chronic inflammation, such as smoking and obesity, well, again, increased risk of cancer. It's probably helpful to define, or at least to remind you exactly what cancer is again. And so let me simplify this. This is not a show on what cancer is, but basically normally cells go through some normal lifespans. We talked about programmed cell death and apoptosis before. Anyway, they go through these life cycles. They live, they multiply, or they reproduce, and then they die. This cycle of events, again, is programmed in our genes. And cancer results from genetic mutations to normal DNA. And basically what happens is that those mutations end up creating immortal cells that grow uncontrollably, and they end up looking very little like where they originate from. In other words, maybe there's a liver cancer and the cells originate in the liver, they get mutated, stuff like that. They start to grow as cancer cells, and they become immortal. They look a lot less like liver cells, although they may still be able to be identified as liver cells. They grow uncontrollably as tumors. They spread through the body, get stuck to other stuff, and end up, killing you. So how would chronic inflammation in the body result in something like that? Well, as it turns out, chronic inflammation can create this sort of micro environment within the body that's really conducive to genetic mutations. Again, inflammatory cells, we talked about free radicals before, right? But the inflammatory cells release those free radicals and nitric oxide, and they can damage DNA and, again, increase the likelihood of mutations. Also, chronic inflammation results in this sort of sustained pro-inflammatory environment with chemicals called cytokines. And those can activate various signaling pathways that are known to promote tumor cell survival and proliferation, and even grow new blood vessels. So, all of these processes that ultimately contribute to the growth of tumors. Another way that systemic inflammation or this chronic inflammation promotes cancer is that inflammatory cells, which are, again, the cells that are reacting from your immune system, like macrophages, neutrophils, all these kinds of things. What they do is they infiltrate the tumors and release factors that actually promote the creation of blood vessels called angiogenesis in the tissues themselves. So they're promoting the ability of these things to actually give themselves a blood flow and grow. So ultimately, these processes enable cancer cells to establish a blood supply, invade surrounding tissues, and that facilitates tumor growth and metastases, which is the spread of cancer. In other words, not only does inflammation increase the risk of mutations that cause cancer to form in the first place, but once those cancers start accumulating, inflammation helps the tumors to grow and spread. So, inflammaging, that's what we're talking about here. And so now that cancer's there, it's spreading, and chronic inflammation also makes it harder to fight off the cancer. It impairs the immune system's ability to recognize and eliminate cancer cells. So there you have it. It's inflammation, has a huge role in cancer. So are there therapeutic implications? In other words, if we know that inflammation probably plays a big role in cancer, can you then say, well, can drugs that actually decrease inflammation then, prevent or help treat cancer? So there's some evidence of that. Anti-inflammatory drugs, corticosteroids, they've shown some promise in reducing cancer risks in some populations. There's a few studies showing this. There was a randomized control trial showing that regular use of aspirin, which I think is, again, I won't recommend it, but I'd use it on a regular basis, baby aspirin every day, reduce the risk of developing colorectal adenomas, which are basically precursors of colorectal cancer, and seem to do so by about 20% over a 4-year period, which is pretty significant. There's also some targeted therapies that are coming up that specifically are cancer therapies that are targeting some of these inflammatory pathways, like NF-kappa beta, STAT3, things like that. Not that you need to necessarily know that, but just know that again, inflammation seems to be a target of some of the therapies that are coming up. So now we've covered two of the biggest killers known to man, and the evidence is strong, again, that chronic inflammation in the body seems to play a role in both. But as I've said before, it's really, it's becoming very clear to me, though, that just about every disease process, especially, diseases related to aging, there seems to be a link to this whole chronic inflammation thing. Again, John Foley and I talked about Alzheimer's disease. Researchers have identified increased levels of a lot of these inflammatory markers in the brains of individuals with Alzheimer's disease. Inflammation in the brain is a thing, often referred to as neuroinflammation. And I believe Dr. Foley talked about this, but how it can contribute to the accumulation of these abnormal protein aggregates, such as beta amyloid plaques and tau tangles, which are basically characteristic of Alzheimer's disease, right? So again, targeting neuroinflammation too. I think he mentioned that as a focus of potential therapeutic strategies. Again, there you have it again. It's just inflammation everywhere. And finally, as it works with disease processes, it wouldn't be a Sapio medical show without mentioning type 2 diabetes, which is the disease that I think is fair to say that it's basically an accelerator of virtually all other diseases of aging. As it turns out, low-grade chronic inflammation plays a role in the development of that disease itself, of diabetes. So what we know is that chronic inflammation can interfere with insulin signaling pathways and lead to insulin resistance. And basically that's where the body's cells become less responsive to insulin. And that, of course, is the disease of diabetes itself, and results in higher blood glucose and all of the negative consequences of that. So I am guessing that that's a lot of information. All right. But hopefully it's clear that the idea I'm trying to get here is that systemic inflammation, chronic inflammation, seems to have a very significant positive correlation with diseases of aging. And again, that's why we call it inflammaging. While doing this, I couldn't help, though, also to think about other questions in my mind, which I don't really have the answer for. But, I mean, in my mind, I'm thinking to myself, I've got a bad back, all right? I've had a bad back since I was 15 years old. And right now I've thrown out my back again, and it feels horrible. And there's a huge amount of inflammation there, and it'll probably be that way for a few weeks. So does somebody with chronic orthopedic pain like that, does that increase your risk for diseases because you're constantly having these low-grade inflammatory responses in your body? I don't know. I know it actually almost, if you're medically trained, it almost sounds kind of ludicrous to link those. But if indeed low-grade chronic inflammation causes all these, or contributes to these aging processes, it seems like it might be possible. And there's no way to link it because no one's going to do a study on that because they think it would be so far-fetched. But then again, maybe it's possible. I don't know. There's not a whole lot I can do about it. But just thinking out loud. Anyway, I think the moral of the story is that we have to do what we need to in order to minimize inflammation in our bodies, to optimize health, to promote longevity and health span. That's how to do that. That is another show, and I don't have all the answers, but it certainly involves diet modification, exercise, potentially other pharmacological treatments. I mentioned I'm already on colchicine and aspirin, and I suspect the story on inflammation as a major contributor to aging and disease, it's still under-recognized. It's probably still going to continue to reveal itself as time goes by. Anyway, that's all I got this week on Sapio with Buck Joffrey. I really hope you are enjoying this. I know I'm getting into the weeds a little bit on some of this stuff. Hopefully, I'm trying to make it understandable for most people. I would really appreciate it if you'd email me, buck@sapiopodcast.com. Let me know what you think, because I'm doing this. I'm learning a lot about this stuff because I want to, but it's also a time-consuming process to go through this, and I'd like to know if this is of benefit to people. That's it for me this week, though, on Sapio. This is Buck Joffrey signing off.
Thanks for listening to Sapio with Buck Joffrey. A quick reminder that while I am, in fact, a surgeon, nothing I say should be construed as medical advice. Now, make sure to include your physician in any medical decisions you make. And also, if you're enjoying the show, please make sure to show your support with a like, share, or subscribe. Until next time, this is Buck Joffrey for Sapio with Buck Joffrey.